Okay, so this is the shoulder immobilizer or shoulder sling that we'll put on you after your shoulder surgery. So when you wake up, we'll have already put this on. You don't have to worry about getting it on initially, but taking it off and on and taking a shower and clothing yourself, just a few things to get familiar with it in case you lose track of where the straps go and how to work it. So it's really two components. There's the sling itself that velcros to the pillow, and this is called the abduction pillow, and the pillow can be switched if needed to left and right based on which side you had your surgery on. For this side, it's going to be on the left, and then this is the initial strap that will go around the neck, and then the second strap is on the pillow, and it's attached to the pillow, and it goes around the waist just for a little extra support. Obviously your elbow will come into the back here where it's cradled, and your fingers will come out the open end. This is meant to hold your hand in. When you wake up, you most likely had a nerve block that's going to make your hand and your arm numb, and so this is nice because it doesn't allow your hand to fall out where you can't feel it. You may not need this once the block wears off, and that's perfectly fine. The ball just gives you something to do so that you can keep moving your wrists and your fingers and keep that active to help prevent further swelling into your hand after the surgery. Okay, so this is the sling. Erin has her sling on. The first thing that's important is where your arm is resting. So we want the arm to rest more at the side in this what we call gunslinger type position, and not in front of you. If the arm's resting in front of you, then it's got too much rotation here in the shoulder, and then when we start rehab, it's going to be a lot harder to get your arm back to more of a neutral position. So the pillow needs to be snug up against your chest. Make sure that the waistband is around. There's different ways that you can adjust the waistband, and so make sure that you have that nice and tight. There's two ways to adjust it, one in the front, one in the back, and that attaches to the pillow. As far as the sling goes, it's the same thing. You want to try to get this part of the cushion over the neck so that you're not having it dig into your neck. You can also get some padding up here if you want to help put more padding on the neck if you feel like it's pulling too much on your neck. Another thing you can do when you sit down, just so that you're not having the constant tension on your neck, is get some pillows under a couch and you can support it so that you can take this strap off. The strap on the neck is also adjustable from both ends, front and back. The pillow and the sling are attached to Velcro, and so there shouldn't be any reason to mess with that. This is the strap that you can put over your thumb just so that your hand doesn't fall out. This is typically only needed while you have a block, when you can't feel your hand. Once you can feel your hand, you can really remove this strap. This final strap is really just a little extra strap to keep your arm into the sling, and as long as you have it adjusted well, this is what it should look like, with the pillow nice and snug, the waistband nice and tight so that all this tension is not on the neck. When you start to take off the sling, just make sure that you have some help initially. You can either rest it on a couch or have a friend or loved one that'll hold the arm for you. You pop the neck part off, pop the waist off, and then you can support with your good arm the elbow as you take this off, and then keep it by your side so that you can shower, take off, or let it rest and breathe a little bit. It's also good to get an ice machine on right here and then put it back on, especially at night where the ice machine can cycle off and on and you don't have to keep taking the sling off and on.